And we are now live.
Thank you. This is Senate Appropriations. We are continuing our work on the FY 2022 budget. We had the folks from Department of Mental Health in a few days ago, and there were some additional areas that we didn't have time to cover. So they're kind enough to come back on a Friday afternoon and present the other areas. And I know that we have documents that were sent to us earlier that Chrissy has sent out. So I'm going to, since you know the areas that we would like you to update us on, let you take it from here. And I don't know if you're going to do the presentation, Commissioner, or how you want to proceed, but I know maybe you want to work off those slides and do it through screen sharing, or just I'll let Chrissy know.
Okay, well, good afternoon. For the record, Sarah Squirrel, Commissioner of the Department of Mental Health. Nice to see you all this afternoon. I am joined by Deputy Commissioner Morning Fox and Shannon Thompson, who is our Finance Director. I will go ahead and share my screen. That's probably easiest. There might be some times where we can bring it down so it's easier for everyone to see each other for discussion. There are three main areas that we hope to cover with the committee this afternoon. That includes an overview on some of our collaboration with law enforcement, some of the recommendations that came out of Justice Reinvestment, an update on the Brattleboro retreat, and then an update on where we are in terms of implementation of Vision 2030. So with that said, I will go ahead and share my screen. That's probably the wrong screen, correct?
Well, I don't know. All I've got is the department name and your name and Morning Fox. That's it.
Is it a large PowerPoint or is it like small?
Nope, it's large.
Oh,
Large.
great. Okay, sorry. I'm on a new computer, so great. Well, that's good news.
Oh, yeah, it says this is the one that was sent.
Okay, perfect. Excellent. Okay, so we're going to jump in and first talk a little bit about some of the collaboration that DMH is currently doing with law enforcement in the criminal justice system. Deputy Commissioner Morning Fox is going to talk a little bit about the partnership with Vermont State Police. You'll recall the efforts to really discuss and think about how we can have mental health crisis specialists working side by side with state police, possibly embedded in those barracks. So Deputy Commissioner Morning Fox, I will turn it over to you, and then I can give a little bit of an update on the Justice Reinvestment piece, which is some funding that's included in our budget.
Thank you. For the record, Morning Fox, Deputy Commissioner, Department of Mental Health. As folks remember, at the end of the very late end of the last session, money was appropriated through Department of Public Safety for this initiative of having co-located or embedded mental health workers within the Vermont State Police. Since that time, during the months of October, November, December, and most of January, a core group of people from the Department of Mental Health, as well as the Vermont State Police and the two current mental health specialists who are working within state barracks, who work for Northwest Counseling Services and HCRS down in the southern part of the state. Those folks and we work together to develop job description parameters, the onboarding and training parameters, as well as memorandum of understanding that will be used between the local designated agency and their local Vermont State Police barracks. Part of that process includes engagement with stakeholders ranging from the Adult State Program Standing Committee, local standing committees, the designated agencies, Vermont Care Partners, Vermont Psychiatric Survivors, NAMI, as well as Susanna Davis and other stakeholders throughout the state that may have interest in this program. We took the feedback that we received from those folks and that helped us to develop the memorandum of understanding, the job description, and the onboarding documents. We're currently finishing up now the final pieces on all the data collection and how the data can be collected, and just getting through some of the hurdles with the various electronic means that information is collected, both through the mental health system as well as through the Vermont State Police and their systems. And actually, we have hopefully our last meeting next week to finalize that data piece. And then the plan is at that point, we'll be able to start rolling out these projects with the designated agencies and start the interviewing process and hiring process for these positions. So I think we're in good standing. We're about to get this off the ground, and it's taken quite a process to incorporate all the feedback from the various stakeholders. But I think we've done a fairly good job in trying to incorporate most, if not all, of the feedback in some way, shape, or form, including things like levels of education, having peers as the ability to be a part of this, or even be selected as an individual that may be the mental health crisis specialist working with law enforcement. So we're really trying to eliminate any barriers to that. These will be folks that part of that feedback was, and we agree with, these will be folks who will respond with law enforcement, but will not have the certification from the state to engage in involuntary treatment screenings. They will go through that training so that they understand the legal aspects regarding involuntary commitment laws. However, we do not want these individuals to actually be able to kind of practice that piece of the law as much as possible, because we don't want that to be a barrier for any individual to feel comfortable to engage and work with these clinicians. That was a clear piece of feedback that we received, and agree with, that a clinician that has the capacity to file for involuntary treatment could be a barrier to someone being open and honest about what's going on in their current situation. So that's really the update, but we're coming in at a time to be able to present that to you just as we're really about to kind of launch this project fully, and I think we're right at the precipice of getting that off the ground.
So if we could pull down the screen for a minute and I could see committee members. You're finishing up the sort of the development work and the job descriptions. So there will be, the next step is actually recruiting for the positions.
Right.
And that would be a joint process with.
Yes. And that's part of the MOU, that the hiring process would be a joint effort between the designated agency with state police input as well. These individuals will all be employees of the designated agency. They will fall under designated agency personnel and HR policies, performance reviews. State police that they work with, barracks commanders, et cetera, can give input to, say, a performance evaluation, or if concerns come up, but the ultimate HR responsibilities will be with the designated agencies.
Okay. Yeah, Senator Sears, and then Senator Starr.
Again, the question I have is, the designated agencies being given all the jobs that they have, are they able to provide this service?
Oh, I think clearly.
Are we confident
I'm very confident.
throughout the state?
Yeah, I think the only piece that, and it's yet to be seen, would be as if they have difficulty in hiring for one. but we're looking at one position at each agency. We're not looking to staff, a facility, a unit, or something of that sort. It's not a 24/7
Understood,
program.
understood.
So,
Well, but isn't it available 24/7? I mean, I thought that and isn't it available to, for example, if they're housed at the Shaftesbury Barracks in Bennington, wouldn't they be available to the Bennington PD, the
What-
Winhall PD, the Manchester
Yep.
PD?
with the amount of funding that was provided, in order for us to get this across to most of the barracks, we'll be able to hire one position for this. The decision as to what kind of shift or time frame that position would actually work will be left to the agency and the barracks. And during the off times, and this is actually included in the MOU, during the off times, when that particular clinician is not available, that the emergency services of that agency would pick up those responses and respond as they can, either through phone or in person.
And it seems like last year, the funding that was identified was enough except for one. And then the governor's budget is proposing the additional money for that barracks. Can you confirm my memory on that? Or maybe not. It's public safety, so
right.
we should ask them. But
And
we did remember that there was one barracks that the funding was not sufficient. So that I think that's
Does it have to be with a designated agency?
That's my understanding, that's the intent, that it's with designated agencies, and that it was $525,000 that was money from the Department of Public Safety that they were able to find from unfilled positions, and so in really thinking about that, that would cover for the most part 7 new positions. Is the intent, and there's already 2 positions that are out there already, and so this would get us to 9 to cover 9 of the 10 barracks.
We had a lot of discussion, and I do remember the original language, I think, did have something. If, for example, there was difficulty or the relationship between the DAs, that there was some fallback that permitted a contract for the service. So if everything is moving along, and this is unlike so many things, it came with a resource to add as opposed to competing with everything else the DAs are supposed to do. But that, I think, Senator Sears, that was in our original language that used that term, had that provision around, or another contractor.
Yeah, I mean, after the House hijacked the whole idea.
Well, I think we are thinking around this is so important to change the culture of policing and give a mental health response rather than a law enforcement. I think we did our best, Senator Sears.
I agree, but it's frustrating.
So I think a lot will depend on how actual experience, and that's why, at this point, we're just at the beginning phase, but I think we're gonna, and I think actually this would be something for justice oversight to be getting updates on as we proceed with implementation.
That's a good idea.
Okay, Senator Nika.
So in the locations where this is already occurring, I'm thinking of Rockingham, we know from that action there that is working very well and is helping the communities around there who also benefit from it. So was there some question? It sounded like there might have been some doubt in something that you said, that they won't all be stationed with the state police. Am I reading that right? Or hopefully they all will be, but.
No, that's the intent right now, is that they would be co-located in each barrack. It's just that they will be an employee of the designated agency, but they will be working out of their primary work location will be out of the barrack.
Very good.
Okay, thank you for that update. I think we'll be very anxious to see how this goes, and we'll confirm And Stephanie, do you, off the top of your head, do you remember, did we have a position? I thought there was additional money in the public safety budget to bring in the last barracks.
Yeah.
But it's very hard to remember the entire state budget.
I will double check. I don't know off the top of my head.
Good, that makes me feel better. All right, so we'll move on then, unless there are further questions about this initiative. Anyway, we're very, this is something we care deeply about. The more you see the news clips and you see, I see Bobby, and you need to unmute, but you can see how so many times people in the midst of a mental health crisis become so vulnerable with what is oftentimes not the mental health response, but from a law enforcement perspective. So,
and I fully expect that this will tell us in short notice. We've already seen it having some successes, as Senator Nitka mentioned. And I think this will tell us and inform us in short notice, some of those successes and some of those impacts, but then also some other ways to implement some of this work, trainings within dispatches and such like that, and how to divert calls from law enforcement in the first place. There are a lot of other models that we can kind of incorporate into this project as it continues. And like yourself, this is something I'm extremely interested in and passionate about. And so I'm very hopeful about where we're at and the direction we're going.
Senator Starr, you have a comment or
well,
question?
I think a lot of it got answered by Senator Sears' question. I just was wondering, with one clinician at each barracks, I would expect some of these problems are going to happen on the weekend, and how all that timing was going to get coordinated with just one employee per barracks. But I guess you got it pretty well figured out.
I think the way it's going to play out, and I think it's probably best to leave it kind of to the local people to figure out where their stress points are, or their historic issues and times are. I would expect that a lot of these shifts will be looking at evening shifts, weekend shifts, things of that sort, and then adjusting as needed as the needs appear as well.
Yeah.
Thank you. So then I guess the next item was the retreat, an update on the retreat. And then the last was the 2030 vision.
Yes, that's correct.
Did we cover justice reinvestment?
Oh, I'm sorry. It's that, which is, I'm just doing it off the top of my head. So what comes next? I'm sorry. I may be out of sequence.
Yeah, no, thank you, Senator Kitchell. And I just want to thank Deputy Commissioner Morning Fox for his leadership on this work that we were just discussing. So justice reinvestment is part of our FY22 budget request. So we did touch upon it briefly when we testified. I don't think we had a lot of time to really do a deep dive. So I'll just provide an overview again, just as a refresher for the committee. Certainly Senator Sears has been a leader when it comes to the justice reinvestment efforts. And I guess I'll talk a little bit about the funding, why it matters, the policy recommendation, and what we're looking to implement. So the funding itself is $400,000. This came from the recommendation of the Justice Reinvestment Group. It's really looking at increasing care coordination for mental health and substance use services, specifically for individuals who are going back into the community on probation and parole. So the policy recommendation that we're, really trying to drive with this initiative is really to strengthen the connection to mental health services and supports and substance use services and supports at the community level when someone is transitioning out of corrections and back to the community. The data that we have nationally and in Vermont, we all know that mental health and substance use challenges are overrepresented in the criminal justice system. This is an opportunity for us to, expand and strengthen those care coordination points, referral to services, so that we can, reduce the amount of rearrest and recidivism. We certainly know that many Vermonters who are transitioning on probation and parole are experiencing some gaps in terms of transitioning to the community, which puts them at higher risk. So that's what we're trying to accomplish through this initiative. There's 5 main implementation activities I can highlight that we've articulated. I would also note that this funding will be utilized in collaboration with ADAP. It's sitting in the DMH budget, but we are anticipating that we would be somewhat dividing up the funding and working collaboratively on that. So one of the first areas is we really want to work with Department of Corrections to support them in utilizing an evidence-based screening tool to really identify mental health and substance use needs. Ideally, we are doing this proactively and earlier on. So not at the point that someone is preparing to transition today. We want to have those care coordination teams aware of the issues identified, 3 months prior to transitioning back to the community. And we think there's an opportunity that we can support DOC in some evidence-based screening tools to help identify that. And then at the point of transition to the community, we really want to improve and strengthen those care coordination points. So working closely with the designated agencies, the recovery centers, other substance use providers in that community, so that individuals can access both those short-term services and supports, and also the long-term services and supports that they may need in order to be successful. That would include anything from case management, one-on-one individual counseling, group counseling, Medicaid-assisted treatment, peer recovery services, really designed to meet that individual's need as they transition to the community. We are proposing to have 3 demonstration sites across the state to target the initial implementation. Those include Chittenden County, Caledonia County, and Rutland County, and those are aligned with current community-based efforts that the Department of Corrections already has underway. Another aspect of the implementation I would just note for the committee, this is all general fund at this point. We do think there's an opportunity to leverage Medicaid as we go forward. So part of the demonstration site will be able to kind of look at how we could utilize Medicaid as we go forward. Obviously, one of our goals would be to scale this up more broadly statewide, but this will give us an opportunity to see how much we can do that. I think there are other complementary efforts across the state that this will dovetail with. Certainly, we've talked a lot about training for community mental health staff so they can really be well served and positioned to support individuals who have been involved in the criminal justice system. We're piloting some permanent supportive housing programs, particularly in Chittenden County. So we think that this will dovetail nicely with that. Also working on expanding probation and parole offices to have clinical workers on site. So that's another aspect of this that we're also thinking about. So those are the kind of the high level contours of the program, what we're hoping to implement. And again, it's a collaborative effort on behalf of the Department of Corrections, ADAP, and DMH.
Okay, questions? I have one question. Someone mentioned yesterday ADAP is putting out to bid SUD treatment services.
That's a good question, Senator Kitchell. It's my understanding that there is a request for information that ADAP will be putting out related to the service delivery system, but certainly ADAP is much better positioned to speak to that than I am.
Okay, and so it's an RFI. Well, I don't remember who mentioned it, but it obviously does sort of raise a question in terms of the future design or the partnership. Senator Sears, you care passionately about this. What about the justice centers or the restorative justice? So many of them are involved in supporting individuals on a volunteer personal basis. I know in St. Johnsbury, we had 75 volunteers to work with this population. And it just, are they, when you're talking about collaborative, some of this you say, well, this makes so much sense. It should be part of how we do our work. It shouldn't be a new initiative. It should be thinking about how we create that kind of locus of accountability for a successful transition.
I think I'm going to try to be, I have nothing but the greatest respect for my local mental health agency. But I think they've historically struggled with certain corrections populations. And I think all of them have. That's why I think we need to, I hope I'm on the right track here, but I think as we move out justice reinvestment and we use within corrections, embedding workers, that we have services for a tough group to deal with. Let's face it. It's not,
Yeah.
you know, there's a reason they were behind bars, especially now that we have diverted so many people. And so, you know, I think that's where the upgrading, or whatever you want to call it, needs to happen. And so, yes, it's great to have community volunteers and all that other, but
No, I just
I'm-
wondered what their role was in this
right.
collaboration.
I think it's it takes a village type attitude towards it, but I obviously really believe in this, but it's my real concern that that the commissioner pointed out, I think, and it's aptly pointed out, that this is a difficult group to deal with.
Mhm.
It is
Mhm.
not, I remember dealing with the drinkers and brawlers, and the guys that stole your cars. This group, these are pretty hardcore folks coming out, and they have a long history with
Yeah.
substance abuse issues, other mental health issues, many of which might have been dealt with in the mental health system early on, but somehow it didn't get it there. So I think it's going to be what's lacking in our current system. That's what Justice Reinvestment told us, is that the behavioral health, when people come out, it needs to be there, but it's not going to be easy.
No, the pathology that, I mean, some of our have experienced our foster care system right up through. And so,
Yeah, I mean,
you're-
I think we go into this with open eyes.
Mhm.
That, that's going to require some transition for our designated agencies, I'm afraid.
So for each case, one of the things that becomes very,
And for ADAP,
Someti-
by the way,
Mhm.
what?
not just ADAP
Oh.
as well needs to, recognize that many of these folks aren't interested. I've had many people that I used to work with who tell me, I'm not going to take probation. I'm going to max out, because they aren't going to tell me when I can drink my bud or not.
Yeah, no.
What it doesn't recognize that in 90 days within getting out, they're back in jail after they maxed out.
Well, you're right. I mean, obviously, with so many efforts, and they've been successful for diversion and supporting.
Yep.
When you put together, a multidisciplinary team, because of the, complexity and the challenges this population presents, where is the locus of accountability? Other than, obviously, it's with the authority of the Department of Corrections, because they're going to have the ultimate, I suppose, legal authority if it's a violation of probation. But I'm just wondering how we envision, so many times we have everybody accountable and everybody saying they're doing a fine job, and the outcome doesn't change.
Mm.
So is this viewed, and maybe this is a good question for Senator Sears, how do you envision, when you were supporting transition, is the ultimate, who would you look to for the management and the oversight and the locus of accountability here?
So it's all individualized, but I think that the oversight has to be the Department of Corrections.
Okay.
To make sure that the person, isn't a danger to the community. The idea is that if you can provide a job, housing, and supports through, whether depending upon the nature of their presenting problem or problems. Many of them have both mental health as well as substance abuse.
Oh, yeah, about 75%, probably this
Yeah,
group, about
so-
90.
Probably. So, it's providing those supports in the community. Other states have found it successful, and it's a joint partnership. But you have to be willing to make the investment. And but a job is important. Housing is obviously important.
Yep.
And community supports. Judiciary met this morning with a couple of folks from Turning Point Centers, which this committee has done tremendous work with. Those folks are absolutely some of the best supports in the community that these folks can get. So I would think even working with Turning Point Centers, not just.
Yeah, that's a good peer support. Talk
Yeah.
about committed people.
The one from Rutland was talking about going into the prison in Rutland.
Yeah.
Well, it's similar. I think, didn't AA members oftentimes go into prisons as
Yep.
well?
Yep.
Oh, all right. Other questions about where we are on that initiative?
Well, somebody
More
brought
for
up
the-
kids, and I don't want to leave that. That similar problems are existing in the juvenile system, and I actually was a little bit late getting here because I had the first meeting was with BSAA about social workers having problems placing kids and finding beds for kids with significant mental health issues, DCF social workers. And then my next meeting was with the victims groups that Hardy Merrill put together after one of our recent meetings.
Oh, did you find?
So-
Oh, okay.
Yeah, actually, I think we solved FY22, but there's going to be a structural shortage in FY23. That's news we expected. But on the juvenile front, I think we need to make the same effort. By the way, I think we need to really invest in the community-based programming. Expecting social workers to carry kids around their cars because they don't know what to do with them. It's really, and
It's
staying at police stations and so forth. And I don't know what the bed situation is. DCF is now seeing many of these cases. They may not be criminal justice at this point, but they will be by the time they get 18.
oh, well, well, that's an associated topic and an important
Well,
one.
I mean, but when I think about, I just want to mention one. I mean, we have a program in Bennington that was supported by the department for kids in elementary school to avoid the emergency room and having a special place for them to go when they're having a crisis at the elementary school. And when you think about the need for that in the community, I think we better be prepared.
Oh, well, I got to move on. You're making me feel really weighted down, Senator Sears.
Well, I'm weighted down.
Maybe we should move on to our next item. I realize it's about 2:35 and we still have 2 more to go in terms of an update. And unless there are further questions, and I know Justice Oversight is going to be really monitoring the progress here as well. So now are we at the retreat?
Retreat. I feel like going there after my last conversation.
I know you're going to say we're all going to need therapeutic intervention, or maybe just a break.
A break.
So, Commissioner, is the next item on your agenda that you would like to bring us up to date? Is it the retreat?
That's correct.
Okay, and then the vision is the final one.
Correct.
Okay, so why don't we move on to an update on the retreat?
Okay, sounds good. I will just keep the screen share down for now. I don't know if there's anything material on the slides that I won't cover, so everyone can continue to see one another unless Senator Kitchell, you'd like me to put the slides back up.
No, I mean, in terms of, unless you had something very specific, but we did get from the agency, the latest report on the financial situation. It is very fragile.
Yeah, so I can talk a little bit about some of the work that we've done. I'll start with just a little bit about the funding sustainability plan and background on that. So we're all aware that, even pre-COVID, the Brattleboro retreat was on shaky fiscal ground. AHS and the retreat really came together to address those needs. And this was last March and April, where we were really trying to look at, how to create a path by which, for the long term, the retreat can be stable. That started with the provision of funding. So AHS has provided to the retreat $13.1 million of CRF funds. That was for the period of March through December 2020. And what I would just add is that, the pandemic impact on the retreat, just compounded some of the challenges that it was experiencing. And like other healthcare providers across the state, what we saw were lower census, revenue losses, workforce challenges, and increased costs due to COVID. All of which, the antidote to those was the healthcare stabilization program. The retreat was on kind of a separate track in terms of its funding, but the source of funds was the same, which was the CRF funds. We also paired that provision of funding with a 9-point sustainability plan. At that point, the retreat team, which was comprised of its board of directors or members of its board of directors, its key clinical leadership and operational leadership, along with key leaders from AHS, came together, articulated a 9-point action plan, and then key metrics to achieving that. And we did some steady reporting to the Joint Fiscal Committee over the past several months to document progress on that sustainability plan. It really does kind of look at, a little bit of a three-legged stool in terms of how do we achieve sustainability for the retreat, looking at service delivery reconfiguration, improving business and revenue operations, and achieving organizational efficiency. And again, we wanted to ensure that we were really clear on what those action steps would be, knowing the work that we had ahead of us. We have continued to meet on a monthly basis. We actually had a meeting this afternoon as we all continue to advance the sustainability plan. I can talk a little bit about the progress that we've made on the sustainability plan and some of the key areas that we're focusing on right now, which gets to some of the chair's concerns. The first thing I would just note, which is actually the main focus of our work right now, is looking at an alternative payment model for the retreat. So even pre-COVID, the Agency of Human Services was contemplating a model very similar to what we've implemented for the designated agencies. We implemented payment reform for the DAs, where they are essentially paid prospectively for providing services, and there's accountability and metrics in the back end, and that really gets in, to where we want to advance our system in terms of alternative payment models as we go forward, and values-based payments. So one of the main areas that we're focusing on is standing up an alternative payment model for the retreat. I think the opportunity that we have here is that it will help have a stabilizing effect overall on the organization. They'll have more predictable payments. It will bring kind of their Medicaid funding together into one single payment that they can receive prospectively, and then we can do all of the accounting on the back end. So that is one of the main focus areas that we are looking at with the retreat right now, and we are looking really to stand that up in the next month or two. So I wanted to just highlight that as one of the key areas of the sustainability plan that we're currently working on.
Commissioner, does that mean they have predictability, or does it mean that they end up with a higher in the aggregate more revenue, or both?
Currently, it would mean that they have more predictability, based on what we would anticipate and estimate would be utilization of the beds. So I guess when we think about the alternative payment model, it doesn't necessarily mean more money. It just means that we're providing it more predictably across a period of time with the appropriate accountability on the back end.
Okay, that's my fundamental question. If underneath it is inadequacy of revenues flowing in, how you pay it out, to the extent to which it addresses that underlying problem, but some of that problem was also created by other operational costs, which they've tried to deal with by discontinuing programs and staff reduction. So I was just, I understand the payment reform, but it just wanted to ask you about how that would work relative to the financial situation. So you've answered the question. Thank you.
Great, of course. And the other thing I would just note is that we did implement rate increases for the retreat, but unfortunately with the impact of COVID, if you're in a fee-for-service model, rate increases don't benefit you. So we really also need to see, a recalibration of the system, capacity, workforce, so that the retreat can really realize the benefits of those rate increases that we've been able to provide.
And those rate increases would be embedded in those prospective payments then, when you were building them?
That's correct.
Okay.
The only other, I think, material notes related to the 9-point action plan, obviously one of the big elements of that was the strategic business restructuring. I can provide an update on that in more detail. The retreat is also looking at third-party opportunities in terms of, looking at kind of market demand in the mental health field, opportunities to attract equity and investment to the retreat as well is a big part of the sustainability plan. And then there are several other areas in terms of, looking at other payers and what their rates are that we're all tackling together. But the APM is definitely where we are focusing our energy right now. So I can talk a little bit about the business restructuring. We've had a lot of conversations with the retreat, a lot of conversations with the community, recognizing that the business restructuring that the retreat embarked upon to ensure that it could survive in the future required it to really focus on its core set of services that are really aligned with its mission and vision, which is essentially inpatient services and residential. So the retreat, as you're all aware, made the decision back in the fall of 2020. Part of that restructuring included moving some of its provision of programs to other providers. So that included the Hub Opioid Treatment Program, their alternative school, and the Mulberry Bush Child Care Center. So we worked very closely with ADAP, the retreat, and Habit OPCO and community members to really transition those services. I think that transition has been successful. Certainly, there are always areas that will need to be fine-tuned, a lot of attention to ensuring that individuals who are requiring those services aren't falling through the cracks. But it really was a collaborative effort on behalf of the retreat, Habit OPCO, and ADAP. The other pieces I would note was the Mulberry Bush Daycare. So as the retreat was looking at where can it focus its resources clinically and fiscally on its core mission and vision, it decided that the Mulberry Bush Daycare was something that was outside of that. They were very successful in partnering with the Horizons Early Learning Program to basically transition the oversight and operation of that program to Horizons Early Learning. I do want to just commend the leadership of Chloe Leary, who is an early childhood leader in that community, who is really instrumental in bridging some of those connections. And I'm happy to report that that transition has moved forward. They are continuing to serve children in that community. And so I would call that a success in terms of the transition. And again, Chloe was really instrumental in that. They also closed their independent school, the Meadows and Bridges Independent School. So immediately the retreat, the Agency of Education, AHS, and local LEAs really came together, of course, to plan for how these youth can continue to receive the alternative education components that they needed paired with mental health services. So all of those individuals were able to be placed in other programs. It was a little bit of a mix in terms of some might be receiving individualized wraparound support through their local schools, referral to other alternative day programs, as well as just the continuation of the ARC program. So they do still run the Abigail Rockwell Center, which is a residential program for very young children, and there is an educational component that's attached to that. There is currently a coalition of special educators, superintendents, the local LEA, who are all coming together to really think this through in terms of where do they as a community want to go next. I think they recognize that, regionally having some alternative education capacity is important. I think they're looking at possibly having, 2 different trauma-informed programs. Also, the meetings that I've participated in, the Kindle Farm program has been at the table in terms of thinking about, is there an opportunity to expand that, to partner with HCRS? So again, we really want the community needs and those community members to drive that conversation and for them to make a recommendation to the Department of Mental Health and the Agency of Education to see where that region might want to move things going forward. So I'll just pause there and see if there's any follow-up questions related to the business restructuring.
Committee, questions on that? The childcare program, that wasn't a therapeutic, it wasn't for children who have diagnosed mental health needs. It was a general childcare available to all children in the area.
That's correct. I do think they had capacity to support children that might have more specialized needs, and they are continuing that capacity as well.
Okay, well, that's what Children's Integrated Services is supposed to help with. Okay. You mentioned, and I'm going to move on to, but you talked about working with the community. I'm just wondering, and if I were part of that community, I'd say, but these children are coming here to this facility from all over the state. They're not, their families and their other connections are not just in the Brattleboro area. How does that community engagement work relative to the fact that we've got youth at the facility that are from way beyond that Brattleboro community?
Yeah, that's a really great question. I think for these specific programs, when we think about statewide resources versus regional resources, the school itself was more of a regional resource. So it wasn't necessarily something where we'd be, busing kids in from, the northern part of the state to attend the day school. So it was more regionalized.
No, I was thinking about the kids actually who are in the residential program at the retreat.
Oh, so the ARC program that I referenced is still open. So they are still receiving, that residential program is open and they are, yes. So I apologize if that was confusing.
Okay, all right. Senator Bruce, did you have your hand up? You're
No,
muted.
I was actually signaling my daughter. So.
All right. So at that point, I think we're approaching 3. So I'm going to just move to the last item of the day. I realize the time is short, but it's your work on a long-term vision for mental health in Vermont. So is that you again, the commissioner?
Yes, that would be me. So as the committee might be aware of, the Department of Mental Health really embarked on an initiative, I think it was almost 2 years ago now, to really articulate where are we going as a system of care? Where do we see ourselves in 10 years? And what are the short-term, mid-term, and long-term strategies and actions that we need to articulate to get us there? There was a legislative charge to move forward in this direction, and we took it very seriously. What that started with was our commitment to ensure that the voice of Vermonters was really heard and represented in the vision for where we're going as a mental health system of care. We spent the first 6 months of this work fanning out across the state on a listening tour in communities, really thinking about, what do we do well as a system now? What are the gaps? And then how do we bridge that? And what are the areas we really want to target and focus on? We then took the great thinking of our community members, partners, and that was a mix of, individuals with lived experience, folks from local schools, folks from local healthcare facilities, nurses, school-based mental health programs, family members. We really set an inclusive table. I think we really tapped into the wisdom of Vermont communities. And we then took that knowledge and we established a think tank that was, of course, representative of all of those stakeholders that I just noted. And they successfully, took that information and then created and articulated the 10-year plan. Which I'm happy to send to folks if you want to brush up on some of the key elements of the 10-year plan that really articulated kind of a long-term, comprehensive vision for a holistic and integrated healthcare system. That is really ultimately our end goal when we think about the future of where we're going as a system of care. And it also really clearly articulates what are those short-term, midterm, and long-term strategies, because sometimes we can articulate a very lofty end state. But if we don't know our first step, then it becomes really difficult to achieve that. We're also using Vision 2030 as a backstop in terms of decision-making for the department. So we are looking at funding. When we have federal funding that comes into the department, my first question is always, how does that align with Vision 2030? How does that help us advance on our goals there? And how do we continue to use that to drive the work forward? So I won't go into the detail of all of the action areas. I'll just do kind of a high-level overview. Action area 1 is promoting health and wellness. So of course, just broadly, this is about improving the health of all Vermonters, influencing social contributors to health, eliminating stigma and discrimination, expanding access to community-based care, enhancing discharge planning and services, peer services that are more accessible across the state, ensuring that services are person-led, and the final action area is committing to workforce development and payment parity, which is also absolutely critical to the system as we go forward. So COVID did somewhat stymie some of our implementation plans, but one of our very concrete next steps that I wanted to share with the committee is that there was also legislation last year to establish a mental health integration council that could be, a bit of a tool and a vehicle to help advance us towards this idea of integration of mental health within the broader healthcare system, because that's really critical when we think about access. There are many elements of the plan that fit within that. When we think about our long-term goal of decreasing our reliance and need on higher end levels of care, such as inpatient, more restrictive levels of care. One of the keys to achieving that is more integration between mental health and the healthcare system. So this integration council will be comprised of many individuals from the healthcare community, many who participated in some of the work that we've already done. It will also include folks from DEVA, Dale, of course, folks from the Green Mountain Care Board, as well as the Secretary of Education, in addition to individuals with lived experience, other peers, and advocacy partners. So there's a long list of folks who will be a part of the Integration Council, and that's in the PowerPoint that I sent. We had hoped to stand up that Integration Council in January of this year. Of course, we know now, just given the incredible stress and strain that our healthcare partners are under, it didn't seem like the right time to try to stand up a council that would require a lot of energy and attention. So we have just shifted the start date for the Integration Council to July 15th. We've done a lot of planning to really think about how do we set the table for this discussion to really identify obstacles to full integration of mental health and healthcare, looking at, some of the legal pieces that might get in the way, as well as thinking about any other areas where we can build buy-in and support from our healthcare partners as we think about integration of mental health. So that's kind of the charge, and that is really one of the key next steps for us with Vision 2030.
Okay, we could spend a lot of time on that because there are a lot of definitions of what integration means, from very basic to it's more coordination of services to actually it becomes part of a unified system. So I would hope that part of on this council is someone looking at that overall delivery system, because with our waiver right now, mental health is outside. And some of what we're doing is still, I think, perpetuating the legacy of sort of separating the, head from the rest of the body. So I'm hoping that we can really look at this delivery. And of course, the big part is the mental health to a large extent, at least the Department of Mental Health. You have one payer, and it's the state of Vermont, which actually makes you very vulnerable. You haven't got a good payer mix, and we're not the most robust funding source that maybe people would like to support what's necessary. But part of the whole healthcare reform initiative theoretically is to put more money on the front end and prevention and less need on the more expensive back end. And that sounds easy, or it sounds, who would oppose that? But that redistribution around, how that payment is going and where it flows becomes a very, very complicated conversation. So, but I think it's one that has to be undertaken because we have a very maldistribution. We give a lot of lip service to the importance of mental health and prevention and treatment, but it's still a lot of the policy sets it outside. So good luck on that one as well. Other questions? It's now 2:58 according to my other electronic device. So other questions of the mental health folk? Okay. Thank you for the update, and we do have the slides that you sent, so that is available for further review. And if we have any questions, obviously we'll be back, and you're going to be hearing from the Justice Oversight in terms of how that work is proceeding. So thank you very much for coming this afternoon. At this point, we've completed our testimony for not only the day, but the week. And so I'm going to adjourn the committee for